Good day to each and everyone. We are the Group 5. In this video, we will be discussing renal disease in relation to fluids and electrolyte balance. So first of all, I am Lacsama. So before we define what is renal disease, let us first know the role of the kidneys in fluid and electrolyte balance. We all know that the kidneys regulate the fluid and electrolyte balance of the body by continually filtering the blood. This is vital to maintain a constant extracellular fluid volume and composition. And then, how does the kidney disease affect fluid and electrolytes? So, in renal disease, acute or chronic, one most commonly sees patients who have a tendency to develop hypervolemia, hypercalcemia, and hyperkalemia, hyperphosphatemia, and bicarbonate deficiency are also known as metabolic acidosis. And sodium is generally retained but may appear normal or hyponatremic because of dilution from fluid retention. So what is renal disease? Renal disease, also known as kidney disease, refers to a condition characterized by a gradual loss of kidney function over time. The kidneys filter, waste, and excess fluids from the blood, which are then excreted in the urine. When kidney function declines or an individual has a renal disease, it can result in multiple imbalances such as dangerous level of fluid, electrolytes, and waste build up in the body. Now also in this video, we will be presenting a case study of a kidney failure patient and how does it affect the fluids and electrolyte balance. So kidney failure, also known as renal failure or end-stage renal disease, occurs when the kidneys are no longer able to function effectively, to filter waste products and excess fluids from the blood. So this dysfunction can lead to a range of symptoms and complications throughout the body. The kidneys have several vital functions, including maintaining fluid and electrolyte balance, regulating blood pressure, and eliminating waste products through urine production. So when these functions are compromised, various symptoms can arise. Now, patient X is a female, 63-year-old, Catholic, and a retired teacher. With a history of present illness, one day prior to admission, the patient had a fever that would not subside even when the patient was given paracetamol and mefenamic acid. So, the SO observed the patient condition but no improvement happened. The fever went up to 40 degrees Celsius, patient chilled. So they recalled 2 days prior to admission, the patient was complaining of intermittent abdominal pain and slight chest pain aggravated by coughing and breathing, urinary retention, persistent of generalized body weakness associated with loss of appetite and muscle aches. The patient was admitted before but never been sick like this before. When TSB and medication given at home did not treat the fever and the patient was complaining of difficulty of breathing, the SO rushed the patient to the hospital. Then the patient was diagnosed with acute kidney failure. Then, with a history of past illness, the patient's last hospitalization was in Iligan City at City Hospital. She was admitted due to her diabetes mellitus and hypertension. She stayed a 1 month. So the patient has no past injuries, no medical or invasive procedure undergone. The patient had a chickenpox when still young, completed immunization, no major illness, no allergies. The patient has a maintenance medication such as insulin, amlodipine, atorvastatin, and no non-congenital or developmental problem, and the patient was born via NSVD.
So, assalamu alaikum and good day, everyone. I am Lominog. So, first, of course, we would actually discuss the part of the our case presentation or the our discussions about the renal disease. or kidney disease, something like that. And then I've actually assigned in the part of the case presentation about the pathophysiology of the disease, how it actually flow, how it is formulate due to the process of the disease. So of course, as we know that the pathophysiology has two types, two factors, which is the predisposing and precipitating factors. And then the predisposing factor is actually including here this age, sex, and then race and heterofamilial. So actually, heterofamilial is can be actually get in our family generations. Like for example, genetic mutation or genetic that can you get in your parents in the first generation, second generation, and third generation. Even actually in your higher up great parents. And then for the precipitating factor is actually there is the change that can be changed through lifestyle. For example, the alcohol abuse or alcohol use or drug used. And then the diabetic neuropathy, and then the glomerulonephritis, and that actually can change through changing lifestyles. And then of course we have to move on to the first is actually for the first flow, which is actually decrease blood flow to the renal. It is actually typo, and then it actually blood in the decreased blood flow to the renal arteries, arteries rather. So there can be several reasons for decreased blood flow to the renal arteries, which supply blood to the kidneys. That can cause reduced blood volume, and then the decrease in blood volume known as the hypovolemia, and then of course that can lead to reduced blood flow to the kidney. And then of course this can occur due to the factor such as dehydration, excessive fluid loss, such as actually example through vomiting, diarrhea, or excessive sweatings or several bleedings in our body. So that can be caused by condition like for example hypovolemic shock, and then the heart failure or sepsis or certain medication that can lower blood pressures. And then of course that is the factor that the renin actually is entered to the bloodstream. So that is why in actually renal failure, it's the renin enzymes enter in bloodstream due to the dysfunctions of the kidney. Renin is normally produced by special cells in kidneys as part of the renin, angiotensin, aldosterone systems, which help regulate the blood pressures. However, actually, if the renal failure or the kidneys are unable to properly filters and regulate substance in the blood, leading to an increase in renin level. And the renin plays a crucial role in our renin angiotensin systems. So that is why it's by converting until the renin angiotensins have a crucial by converting actually the type O din to, yung conversion of the angiotensinosin yan into the angiotensin 1. Okay. Which actually further converted na naman to the angiotensin 2. So angiotensin 2 is actually potential vasoconstrictor, that can increase blood pressure. It's actually elevate the contributions to the pathophysiology of the condition and may lead to the complications such as the hypertension and fluid imbalance. What actually the fluid imbalance? Not actually, it's actually, and then magbibigay na naman yung signs to the magfunction na or releasing the aldosterone to actually get more fluid from the our bodies. I mean, the substance that we've been eating or consumes, something like that. So of course, okay, so releasing of aldosterone in adrenal gland. Okay, mag-release na naman siya ng aldosterone in adrenal gland because we are lacking of the sodium. And then once actually it is once the aldosterone actually is been reserved or been released or sent to the our adrenal gland, it could actually given a sign to reabsorb again the sodium to make it actually have a retentions. Okay, mag-retention na naman siya. mag-retention, like ikuha niya, pataasin niya naman yung sodium. Once yung sodium is maliit, automatically aldosterone is giving a sign to the kidney or kidney that you could actually absorb more sodium. That is why sometimes yung ihi natin is hindi sa naiihi because of the lack of water is in our body, and then the aldosterone not giving a signal to maka-urinate tayo, but actually instead of urination, in-keep niya lang yung urine to make sure that if kulang yung fluid sa ating body, it could be reabsorption by the process. And then, of course, like for example, the sodium and water retentions, the kidney plays a crucial role in regulating the balance of sodium and water is in the body. In renal failure, the kidney may not be effectively reabsorbed or excreted sodium and water, leading to the retentions in bloodstream. This retention can contribute to increase the plasma volume. Pag mag-increase na yung plasma volume, which actually increase fluid overload sa ating body, we can actually lumaki na yan, makikita natin yung mga symptoms, mga sign of the changes of our body, that increased plasma volume can contribute to fluid overload in the body. This can leads to symptoms such as swelling, yung edema pag lumalaki na yung mga katawan natin. Like for example, makita natin yung parang trigger pag hinawakan mo siya sa kamay mo na magkuan siya, ang hirap siya mag-turn in a normal process. For example, instead of seconds, nagiging 1 minute, instead of 0.0 seconds, then nagiging 3 seconds, 5 seconds siya nag-return sa kanyang proper position. And then the weight gain, unexpected weight gain. Kasi like for example, kumuha ka, naging kuan na siya, hindi naman yung elephantiasis, but same lang sila. Like for example, has a lot of weight, but parang watery siya, pagka-oily yung mukha ng skin edema. And then a short of breathing, kasi naging na yung function. Pag once na is nagiging yung heart natin should be function as fast as possible, kasi alam niya na kulang yung kanyang binibigay na push or pump to of course send some blood or oxygen or water or something that could actually help the imbalances of the fluid. And then of course fluid overload can put additional strain or already compromised kidneys, making it more challenging for them to function properly. Okay, so it can actually cause impaired filtration and water removal. Okay, the kidney play vital roles filtering waste product. Okay, like for example, the toxin, something like that in bloodstream. And then electrolytes imbalance. Thus, increased plasma volume can disturb the balance of electrolytes in the body. Sodiums, such as sodium, potassiums, and calciums. The kidney actually are responsible for maintaining the proper balance of these electrolytes from actually foods, okay, what that we eat. In renal failure, electrolytes imbalance can occur, leading to complications such as abnormal heart rhythms, muscles weakness, and bone disorders. Hindi siya like for example, the potassium and calcium is need actually in our bone being stronger. That is why the electrolytes neededly to be absorbed and then deliver what actually the need of the bones or other or muscles in this electrolytes. And then of course, fluid and sodium retentions. Lumalaki na kasi yung mga sodium to increase plasma volume can result in fluid sodium retention in the body. This can be further contribute to a fluid overload, hypertensions, and electrolyte imbalance. And then the impaired kidney functions, for example. And then, of course, this that makes it difficult to the kidney to regulate fluid and electrolytes balance, leading to the retention of issues. Okay, so of course, this actually the vasoconstrictors at saka yung increased plasma has actually lahat sila same nagkukos ng increased blood pressure, which is hypertension. Once actually may elevate yung blood pressure, this increased plasma volume can lead also to elevate pag mag-increase yung plasma volume can also lead to elevate blood pressures. This is because the increased volume put more pressure in our blood vessels, leading to hypertensions. High blood pressure can be further damage the kidneys and worsen the progressions of renal failure. Ang bilis-bilis na kasi yung process to, of course, to be our renal being failure. So, of course, we have moved to the decreased tissue perfusions. Once actually the blood pressures and the retention and increased blood pressures, plasma, and we can know that the tissue perfusions become abnormal tissue perfusions, which is actually impair oxygen and nutrition delivery. Like, for example, the blood carry oxygen and essentials nutritions to the body tissues. Decreased tissue perfusion can limit the delivery of the oxygen and the nutrients to the cells, compromising their normal functions. And of course, decreased tissue perfusion can have various underlying causes, including reduced blood pressures. Of course, example of that, the hypovolemia, and then the low blood pressures, hypotensions, and then vasoconstriction, blood clotting formations like thrombosis or a narrow blood vessels are arterial stenosis. In a case of renal failure, decreased tissue perfusion to the kidney can impair their ability to filter waste product, regulating fluid and electoral balance, and of course, and produce hormones necessary for the normal bodily functions. And of course, for the unable to exert metabolic waste product is actually once the tissue perfusion is actually damaged, automatically na mahihirapan na yung mga kidneys natin to filter or actually i-separate kung ano ba ang dapat ilabas at ano ba kung dapat yung i-reabsorb. Kasi hindi yan alam, reabsorb na din yung mga yung mga waste product, tas hindi niya nalalagay ng tamang lagyan. Let's say for example, like yung ihi. Minsan kasi nakakuha tayo ng hematuria, like may blood na may ihi, or proteinuria, like yung mga proteins na nakain natin na naiihi. Like for example that, the kidney cannot actually filter out exerted properly the metabolic waste of products of our body to make sure that they could give a proper placement. Okay? And then of course, it's actually adequate performing their function or filtering and exerting metabolic waste product from the body. They can have a significant implications for the overall health, can all lead to build up of waste product in the bloodstream. Okay, so the kidney plays a crucial role in filtering waste product of our bodies that can actually, kung baga, hinuhugasan niya ni oxygen, ginukuhan niya, tas nagbibigay siya to, of course, to be to like the product like toxin and existing fluid from the bloodstream, and then they remove metabolic waste products such as urea, paihi, sweating, creatinine, and uric acid, which are byproduct of the normal metabolic process in the body. In renal failure na naman, it's impaired kidney function, hinder the ability to effectively filter and excrete the waste product po. And then, of course, as we move on to the some sign and symptoms of unable to exert is decreased urine output. Kasi bakit? Kasi known as the oliguria or anuria is a common symptoms of this. This reduce in urine productions can occur due to the several factors related to the impaired function of the kidneys, decreased filtration, damage glomeruli, and others. And of course, for the other one naman, increase increased blood urine nitrogen, which is the BAM, is actually its level can be observed in renal failure and other conditions that affect kidney functions. And then the blood urine nitrogen is a waste product that is produced when the body break down proteins. Okay? And then the other one na naman is the increased serum clearance. So as we actually this, it typically means that improvement or the kidney's ability to clear substance from the bloodstream. Serum clearance is a measure of how efficiently the kidney remove waste product, toxin, medication, and other substance that from the body. Siya yung nagpi-filter out sa ating ihi at saka yung makakuha natin ng toxin. If ever waste product ba yun? Kung baka nakakain ka na hindi dapat ilagay sa ating bloodstream na rin-remove yan ni kidney, siya yung nag-filter out. Kaya ito automatically needs po, like for example, uh, toxin pag kumain tayo ng soft drink, automatically na may toxin dyan na siya yung mag-filter out kung kukunin niya ba, like caffeine, kukunin niya yung mga something na dapat kunin, i-separate doon sa i-absorb niya. Okay? So, the other one na naman, if treated na naman siya, of course, if the treated siya yung renal disease, acute renal disease, we could actually see the anti-hypertensive, like for anti-hypertensive na mga medication like losartan and other medication that could actually have an anti-hypertensive, the diuretics, and then phosphate benders, at saka ISAs, at saka vitamin D and calciums, and hemodialysis, and then kidney transplant if possible. Yung kidney transplant is when actually when you have an family, nakukuha yan sa family bloodline, kasi minsan kasi hinitugma. So if not treated na naman, recurrent, of course, start na naman siya sa acute renal failure. So the further damage to the recurrent is hindi siya na nagamot, na damage ng mga other part of the kidney such as the glomeruli, whatever the pronunciation, at least I can actually give it a hint here. So okay, so damage for, and the other one is further damage to glomeruli. So okay, for this is which are tiny filtering units in the kidneys can be damaged in renal failure. This damage can result from various causes such as yung isa one of the factors actually, like the glomerulopathy, or the diabetic nephropathy. When the glomerular are damaged, their ability to filter blood and produce urine and compromised, leading to a decrease in urine output. Okay, and so the of course for the hypertrophy of the healthy glomeruli, it's actually refer, or it can increase the size of enlargement of the glomeruli in the kidneys. Even actually if the absence of any underlying kidney disease or dysfunctions, the increased demand of filtration, such as increase of high protein intakes, or a certain the medication condition such as the compensatory response to loss of functions nephrons due to injury or disease in other part of the kidneys, and then the hyperfiltrations in the remaining healthy nephrons, which there is a reductions in the total number of the nephrons, such as in conditions like solidarity kidney or kidney donations. Okay, so the other new one is the number after actually that's related, the healthy glomeruli is actually the number of the hypotrophied glomeruli dies. Bakit? That dies can vary depending on the underlying cause, the severity of renal failure, naging super na yung renal failure na, naging stage na siya na hindi siya nagpa-functions, and individual factors. However, it's important to note the hypertrophic glomeruli themselves are not the primary cause of renal failure, as you can noted this. The hypertrophy referred to the enlargement of the glomeruli, which can occur actually as an adaptive response to certain conditions. In a renal failure, actually, the primary issue lies is the impairment of kidney functions. Okay, kidney functions kidney functions. Further, with this the result of various factors such as chronic kapag nag-over na siya, naging chronic disease na siya, glomerulonephrititis, diabetics nephropathy, or other renal disorder. This condition, of course, This, of course, this condition, of course, can lead to the progress damage to glomerular and other structure within the kidneys. And then that can cause actually renal impairment. Ano ba yung renal impairment? Alam naman natin yan, naging failure na yan siya. Like, hindi na niya actually kayang i-filter out, i-reabsorb, or hindi niya ma-separate kung ano ang kanyang reabsorb po. Let's say, for example, the ihi na naging ina-plus na siya sa bloodstream, naging hematuria, or other proteinuria, mga ganun, hindi niya totally alam kung saan i-input. That can actually symptoms is nocturia. Ano ba yung nocturia? Yung umiihi siya sa gabi na natutulog, or anything that can actually, ang dami yung parang ba ihi siya every day, every night, bitaw. And then the fatigues, and then the further stimulation of regain anti-angiotensins and aldosterone systems, like yung aldosterone naghina na sila. And then further, it can actually further damage occurs. For example, nagka-damage na, nahihirapan na sila yung damage na is naging over na siya, nagka-failure na sa stage 3, may stage, like na stage na siya na, sa stage na siya na hindi na totally nagfa-functions, mamamatay na siya, nag-chemo, magka-chemo pa siya, parang possible na mag-filter out niya yan. Like, nag-work lang yung life niya through chemo kasi yung chemo is actually filtering out your blood if actually have urine or something that in your blood para mag-function properly. And then, of course, renal insufficiency. Like, yung renal na natin, hindi na siya totally na nagfa-function, namatay na siya. And then, the renal failure. Pag renal failure na, makikita mo na yung mga symptoms na mga nawala na siya na hypervolemia, hyperkalemia, hyperphosphatemia, at saka hypokalemia, at saka yung metabolic acidosis. Nakikita mo na siya dyan, hindi na siya magfa-functions, lahat ng negative sides, like for example, hematuria, edema, lahat ng negative that can actually, the work of the kidney that not actually filter out, kaya nagiging damage na sila sa ating katawan. Once the body actually is affected, automatically our whole body or mga organs can be affected too. Let's say for example, if actually the kidney is failure, na of course wala naman yung fluid, walang electrolytes na papasok na filter out niya na to deliver it to our body. Let's say for example, need ng fluid ng ating, of course, lungs to expand properly, like yun negative pressure in our flular space. Diba? Like, nagbibigay dyan siya ng electrolytes. Kasi hindi lang totally magpa-function ng ating katawan if fluid lang. Needs na yung electrolytes. But of course, renal can help to maintain or balance that process of the if hindi naman siya naging renal failure na siya, pati yung chemo hindi na niya makaya, it would be cause death to the patient po. And that would be all, and thank you so much po.
A case of a 63 years old female who was admitted to a Maipakpak Medical Center with a chief complaint of fever and generalized body weakness. So she was diagnosed for having kidney failure. So in this presentation, I will be presenting to you the manifestation we found out to our patient as well as their causes. And also it is related to fluid and electrolytes. So the first one is decreased urine output. Decreased urine output is a primary function of our kidney. It is the one who produces urine by filtering out waste and excess fluid from our blood. In the kidney failure, this process is impaired, resulting in decreased urine productions. So upon checking our patient's urine output, it is less than normal output. So the second is the fluid retention. Upon assessing our patient, we found out an edema to her lower extremities. And the reason for this is the inability of the kidneys to remove excess fluid from the body leads to fluid retention. Kasi nga si patient, meron siyang kidney failure. So, altered na yung function ng kanyang kidney. This causing swelling in the extremities called edema, particularly in the legs, and this can lead to weight gain. The third one also is the shortness of breath we observe to our patients. So the causes of this is fluid retention can extend to the lungs, leading to condition called pulmonary edema. This accumulation of fluids in the lungs can result in difficulty of breathing and shortness of breath. So, kapag merong na-impaired na yung process or function ni kidney, marami talaga itong epekto sa ating katawan. Isa na dito yung lungs natin. To filter out ang blood natin, kapag nasenda ito sa heart at sa lungs, meron na itong kasamang mga toxins kasi impaired na yung function ni kidney para i-filter out yung mga blood. So in the case of our patient, apektado na yung paghinga niya because of having kidney failure. The fourth one we found out to our patient is intermittent abdominal pain. The causes of this is kidney failure can cause a kidney to enlarge, leading to pressure and stretching of the kidney capsule. This can result in intermittent abdominal pain. Additionally, conditions like kidney stones or infection may contribute to abdominal discomfort. So, our patient is diagnosed for having kidney failure. So, meron siyang complaint of having abdominal pain because her kidney is affected. So, kapag may injury, kahit sa anong part ng katawan, kapag may injury, sasakit yan. So, si patient, nakaka-feel siya ng abdominal pain since yung kidney nasa part lang ng abdomen. So, the next one is, we observe that our patient is having a generalized body weakness. So, the reason for this is the buildup of the waste products, such as urea and creatinine, in the blood can lead to feeling of weakness and fatigue. Anemia, common in the kidney failure, can also contribute to fatigue. So, since our patient is na-build up na yung toxin sa kanyang katawan at hindi na niya ma-filter out yung blood natin ng mabuti, nagkakaroon ito ng nagkukos ito ng weakness and fatigue. Syempre, yung lungs natin, hindi na niya ma-supply yung need natin na oxygen kasi may kasama na yun na toxins. Kapag dumating sa kanya si blood, hindi na niya ma-filter out ng mas mabuti or kahit mabigyan ng oxygen yung red blood cells, hindi pa rin sapat dahil meron na siyang kasamang toxins. And also, upon our observation, upon our assessment, we asked the patient and she said na he lost his appetite. Hindi na siya makakain ng mabuti, parang ayaw niya nang kumain. So the reason of this related to the kidney failure is the accumulation of the toxins in the blood can cause nausea and reduced appetite, leading to weight loss. Hindi na niya mailabas yung urine dahil sa na-disrupt na yung normal function ng urinary. So proceeding to the laboratory and diagnostic procedure to our patient, the laboratory result shown a low pH, low carbon dioxide, and low bicarbonate. It indicates that the patient is having metabolic acidosis. So the nursing implications for this is maintain adequate hydration to restore electrolytes balance and normalize pH level. Maintain patient airway and provide humidification of if acidosis requires mechanical ventilator, and institute safety measure and assessed patient in positioning. In hematology, the PTINR test result is too high. This means that the person's blood is clotting too slow and is at risk of bleeding. To help decrease this risk, encourage the patient to do leg exercise and maintain adequate hydration, having the patient avoid venous constriction and such as crossing the legs or wearing stockings or other garments that compress leg veins. Monitor PPT values when the patient is receiving heparin. In chemistry, lipid profile, the patient decreased level of LDL cholesterol may be associated with increased risk of cancer and hemorrhagic stroke. So the nursing implication for this is educate the patient to take medication that is prescribed by the physician, such as vitamin A supplements and other fat-soluble vitamins, and encourage the patient to eat foods that contain high amount of saturated fat. Also, the patient is having decreased level of ferritin, lead to iron deficiency anemia. In this case, encourage the patient to eat iron-rich food as this can boost iron and ferritin levels. Also, in the reticulocytotic indicates hemolytic anemia, a type of anemia which red blood cells destroy faster than a bone marrow replace them. So, blood transfusion and IVF may be needed to replace the lost volume of the blood or electrolytes to restore them to normal levels. So that's all the manifestation that we found out to our patient in physical examination as well as in laboratory values. So, proceeding to the medical management for our case study.
Here are the nursing management. So first is to monitor the patient's fluid status such as the input and output, the daily weights, and the signs of fluids overload or dehydration. Also monitor the electrolyte levels through laboratory tests as ordered by the physician to identify imbalances. Monitor and regulate fluid intake according to the patient's condition to prevent dehydrations or fluid overload. So manage electrolytes imbalances through dietary modification, medications, and also hemodialysis if necessary. You can also administer medications as prescribed by the physician to manage symptoms, control blood pressure, and also to help maintain electrolyte balance. You can also collaborate with dietitians to create individualized meal plans according to the patient's renal function, to provide education to the patients and their family about the importance of adherence to medication, dietary restrictions, and lifestyle modification. You can also educate the patients about the signs and symptoms of fluids and electrolyte imbalances if crucial for early detections and intervention. Then, collaborate with the healthcare team to ensure coordinated care. Also, provide emotional support and counseling to the patient and his or her family as they cope with the challenges associated with renal disease.
Good day, I am Mahdi and I will discuss the medical management. So for blood test, we have creatinine. So creatinine is a waste product of the muscles that the kidneys filter and excrete. Elevated levels may indicate reduced kidney function. Next is blood urea nitrogen. So this measures the amount of urea nitrogen in blood, which our kidneys filter and remove. However, elevated levels may indicate reduced kidney function. Electrolyte panel measures our sodium, potassium, chloride, and bicarbonate levels to assess electrolyte balance. Glomerular filtration rate measures how well our kidneys filter waste products and excess fluids from our blood. For urine test, we have urine osmolality, which assesses the concentrating ability of urine tubules, providing insight into kidney functions. Urine dipstick is a test used for excess protein or proteinuria, which may indicate kidney function issues. For urine culture, it checks for white blood cells and bacteria indicating kidney infection. We have blood pressure medications like ACE inhibitors or angiotensin II receptor blockers. So this is to manage hypertension and fluid balance. We have diuretics to treat edema or swelling, phosphate binders to control phosphorus levels to protect blood vessel from damage. Erythropoiesis stimulating agents or SS is used to treat anemia associated with the condition. And lastly, we have vitamin D and calcium to manage mineral balance and help prevent weak bones. For dialysis and transplantation, so we have hemodialysis, which is a common treatment for patients with end-stage kidney disease. So this is to remove waste, salt, and extra water, addressing fluid and electrolyte imbalances. For kidney transplantation, this is also a best treatment option for people with end-stage kidney disease, offering potential for improved fluid and electrolyte balance and overall health. For lifestyle modifications, so the patient should adhere to a low-salt diet, which is particularly important in managing sodium intake and fluid retention. Low proteins may also be suggested to minimize waste products in the blood. It's important that the patient will be able to manage their fluid intake carefully to avoid fluid overload, which can impact electrolyte balance. And lastly, patients must adhere to their prescribed medication to manage fluid and electrolyte imbalances effectively. For the actual medical management, so the patient was given a PNSS regulated at 20 drops per minute. So this fluid will help restore fluid volume, improve blood pressure, and support kidney function by ensuring adequate blood flow to the kidneys. It will also help maintain the electrolyte balance by providing sodium and chloride ions. Also, it helps improve urine output by increasing the blood volume and perfusing the kidneys better. So the doctor ordered a diet of low sodium and low fat diet. So restricting the sodium intake helps control fluid balance and blood pressure, reducing the workload on the kidneys of the patient. Reducing fat intake, especially the saturated and trans fats, can help in managing cholesterol levels and decreasing the risk of cardiovascular complications for the patient. Another order of the patient is of doctor is to secure blood drainage, PRCB of patient's blood type properly screened and cross-matched. So blood transfusions with packed red blood cells can help correct anemia and improve oxygen delivery. Check vital signs every 4 hours. So vital signs helps to track patient stability or detect any changes that might indicate either deterioration or improvement of the condition. Next is to check input and output during the shift. So input and output helps evaluate the kidney function, assess urine output, and make adjustment in fluid intake or medications to prevent fluid overload or dehydration. For laboratories and diagnostic procedures, so we have CBC. So a complete blood count can reveal abnormalities in red blood cells, white blood cells, and platelets. Next, we have NAKs or sodium and potassium. So to measure the levels of sodium and potassium electrolytes in the blood. We have creabond or the creatinine and blood urine nitrogen. So this test helps assess the kidney function of the patient. Urinalysis. So this test evaluates the physical, chemical, and microscopic properties of urine, and also helps detect conditions like proteinuria, hematuria, and other changes in the urine concentration. We have ACT or AST. So this means aspartate aminotransferase and alanine aminotransferase. So these are liver enzymes that, when elevated, may indicate liver damage or disease. Next, we have blood typing. So blood typing is important for blood transfusion. Chest X-ray helps evaluate the condition of the lungs, heart, or blood vessels of our patient, especially with a severe condition of acute kidney failure. Next, we have 12 lead electrocardiogram. So this can detect abnormalities in heart rhythm or structure due to electrolyte imbalances and fluid shifts. Next, we have arterial blood gas. So this measures the acid-base balance and oxygenation levels of our patient. For lipid profile, so this is important as acute kidney failure patients might have increased cardiovascular risk, and lipid abnormalities might affect the overall health condition of the patient. Next, we have PT or PTT. So this test evaluate the blood clotting function of the patient. Next, for medication, so patient was given ceftriaxone 2 gram IV every 24 hours. So this is an antibiotic used to prevent and treat various bacterial infections. So in cases of a patient with acute kidney failure, infection can often exacerbate the condition. Next is omeprazole 40 milligram IV once a day. So omeprazole is a proton pump inhibitor that reduces stomach acid production to prevent or treat issues like gastrointestinal bleeding or ulcers. Atorvastatin 40 milligram IV once a day. So atorvastatin is a statin used to lower cholesterol levels. So patients with acute kidney failure might have increased cardiovascular risks, and managing cholesterol levels is crucial in reducing these risks. Next is paracetamol 500 milligram IV every 4 hours, as given as needed. So paracetamol, or also known as acetaminophen, is given as a pain reliever and fever reducer. For the next day, so the patient was given an order of low salt, low sodium, low salt, low fat, and DM diet. So DM diet refers to diabetes mellitus diet. Regulating the blood sugar levels through dietary modification is important in managing both diabetes and its potential impact on kidney function. They still monitor vital signs every 4 hours, monitoring of input and output. And for the laboratories and diagnostic procedures, we still have renal disease lipid profile and CBG monitoring twice a day. So CBG refers to capillary blood glucose. So it is essential that we monitor the blood sugar of the patient, especially when the patient has a condition like diabetes mellitus. For medication, so there is a sodium bicarbonate tablets or one tab twice a day. So sodium bicarbonate is a medication that helps balance the body's pH. So in the condition of our patient, there can be a acid-base balance due to decreased kidney function. So the sodium bicarbonate helps correct metabolic acidosis by neutralizing the excess acid in the blood. Next, we have calcium carbonate, 3 tabs. So this medication is used as a calcium supplement. So patient with kidney failure often experiences imbalance in minerals. So proper calcium levels are also important for bone health and nerve function. Next, we have erythropoietin, 4,000 IU two times every week. So erythropoietin is a hormone that stimulates the production of red blood cells. So in patients with acute kidney failure, the kidneys may not produce enough erythropoietin, leading to anemia. So supplements with erythropoietin helps manage anemia by increasing red blood cell production. Next, we have losartan 10 milligram, 1 tab twice a day. So losartan is an angiotensin 2 receptor blocker. So it is used to manage high blood pressure and relax blood vessels. Next, we have bisacodil 5 milligram suppository. So it is a laxative used to relieve constipation. It will help stimulate bowel movements. Next, we have laboratories and diagnostics. So thyroid stimulating hormone and free thyroxine helps assess the thyroid hormone production and can indicate any thyroid-related issues that might influence kidney health. Next, ultrasound of the thyroid gland is used to assess the structure and condition of the thyroid gland. Reticulocyte count, total iron binding capacity, and ferritin is our test to evaluate aspect related to anemia and iron metabolisms. Next, peripheral blood smear is to assess the shape, size, and appearance of the blood cells. It can help assess also for anemia. For the next day, we have facilitated X-ray posterior-anterior view. So this is to assess for complication or changes related to fluid overload, heart failure, or respiratory issues, which can occur as secondary effect of having a kidney dysfunction. And again, the patient was given a blood transfusion. Thank you.